Welcome to Monday's edition of COVID-19. Korea has recorded fewer than 1,000 cases today for the second straight day. And authorities are linking this decline to the fewer COVID-19 tests conducted over this weekend. Officials have also extended the level 2.5 social distancing here in the metropolitan region with stringent measures on social gathering until next Sunday, while the rest of the country faces level 2 social distancing. I have Kwon Soa standing by with the latest on the pandemic here and elsewhere around the world. So I believe we are starting the work week here in the country with a drop in the daily tally.
Right, Sunny. Korea reported its smallest number of cases in 2 weeks. 808 infections were reported on this last Monday of the year. With that, Korea now has a total of 57,680 infections. The death toll stands at 819. Now, if we divide Monday's cases into domestic and imported infections, we do see that domestic transmissions have dropped to the 700s, but as Sunny earlier mentioned, this is likely due to the lower number of tests conducted over the Christmas weekend. Now, speaking of which, it was Christmas Day when the country reported its highest ever daily caseload of over 1,200 infections. But since then, we are seeing a gradual decline. But again, we still have to wait for the rest of the week's figures as well. Now, while the average in domestic infections in the past week meets the criteria for level 3 social distancing measures, the government decided to extend the current measures, so level 2.5 in the metropolitan region and level 2 elsewhere. And this means the second and third highest of South Korea's 5-tier social distancing scheme. And these will be in effect until January 3rd, along with the ongoing restrictions on private gatherings that were implemented to lower the risks of infections over Christmas and the year end. An additional measure was announced on fast food chains, meanwhile, that won't be allowed to let customers eat at tables from now on if they only buy beverages or desserts. There have been concerns over people flocking to fast food restaurants as coffee shops under the current social distancing measures only are allowed to offer takeout or delivery. Now, along with these extra prevention measures, many places in the country are also setting up more and more temporary screening centers, not only in the metropolitan region, which had some 550 infections this Monday, but also Daegu and Busan, as well as recently Gwangju, have expanded their temporary screening centers, as they have also double-digit figures, as we can see here. Now, meanwhile, 21 infections today were imported cases, with 8 of those reported at the nation's airport or seaport. And now the country is on even higher alert when it comes to these imported cases, as Korea confirmed the new COVID-19 variant in 3 South Korean nationals who arrived from the UK last week. This strain is said to be up to 70% more transmissible. And Sonia is going to go into the details on that later in our Skype, I believe.
Yes, I am. I have David Cox lined up later after your segment. Now, this variant is also being reported by a growing number of countries, I hear, Soa.
Right, Sunny. When it comes to this new variant, neighboring Japan confirmed its first case a few days ago, banning all foreign arrivals. Spain, France, Sweden, Canada, as well as an island in Portugal has reported cases as well. And this is one more reason for why vaccination is desperately being awaited, and the EU has kicked off their vaccination program over the weekend almost simultaneously, but Hungary and Germany kicked off theirs on Saturday, while most other members started on the day after. And mostly healthcare workers and the elderly at nursing homes were among the first to receive the shots. Now, let's take a quick look at the numbers around the world. There were many developments over the weekend, with milestones being hit here. Russia surpassed 3 million cases and Italy 2 million. And we have the Ukraine, Peru, and South Africa all surpassing 1 million cases over the weekend. And with that, the total number of infections stands at 81.1 million. And those are the numbers I have for now. I'll be back with more updates in a bit. Sunny?
All right, so thank you for that for now. News of COVID-19 virus mutation is making global headlines as more countries detect the new variant in their respective territories, as our consul just mentioned. Meanwhile, in the UK, after reporting the new strain of the virus earlier this month, authorities there last week found a second, possibly more transmissible variant that had earlier been identified in South Africa. Now, for more on this finding, I have David Cox, a health journalist in London, live on the line. Welcome back, David.
Thanks so much, Sani. Thanks for having me.
Right, David, please start by telling us about the second new strain of the virus over in the UK.
Yes, so basically this new strain was thought to have emerged in a patient with a weakened immune system who was unable to beat the virus. And so their body basically became a breeding ground for the virus to mutate again. And basically over the past few weeks, this new variant has rapidly replaced all other versions of the virus. And it's become the dominant strain right now in the UK. And the key thing is that this particular variant has a mutation which increases its ability to infect human cells. So right now, this particular variant is accounting for 2/3 of all new COVID cases in the UK, and it's particularly widespread in London and all of the southeast of England.
I see, that is quite concerning. David, what else is known about the second strain so far?
So basically, this second strain, it has a particularly key mutation in the virus's spike protein, which increases how tightly it binds to human cells. So basically, it makes it far, far more infectious. And this new variant in particular is thought to be about 70% more infectious than the previous variant of COVID-19, which is why it's spreading a lot further than before. So what happens is basically when you take a swab of someone who's infected with this new variant of coronavirus, they have a much, much higher viral load in their cells. And that's why it's much easier for them to then pass it on to other people.
So, David, are authorities there linking the recent rises in COVID-19 cases to the presence of this particular variant then?
Exactly. So that's basically the main reason why right now London and pretty much all of the southeast of England are in a lockdown situation to try and stop this new variant spreading any further.
Well, David, in response to the situation in the UK, quite a number of countries have decided to halt their air traffic with the UK. How are officials there seeking to tackle this latest challenge?
So this is the thing. So the biggest concern actually for the government over the past week has actually been that France was blocking the land border. So that was a major concern here in the UK because that's a big route for us to get food supplies in. But basically in the past 3 or 4 days, that land border has been reopened. I think in terms of the actual, in terms of air traffic to other countries, there's very little which the government can really do. So the US have basically introduced a rule where any travelers from the UK to the US have to have had a negative COVID test 72 hours before departing. And I think other countries are going to introduce similar restrictions. So basically people can travel for business from the UK, but as long as they actually have a negative COVID test several days before traveling.
Right. David, I believe the vaccine developed by AstraZeneca and Oxford University is awaiting the green light from relevant authorities in the UK. What is the latest on that front?
So actually, we expect some really positive news on that later this week. So basically, by Thursday, we expect that vaccine will be approved by the regulators here in the UK. So that's extremely positive news because it is thought that even with this new variant, the vaccines will be able to protect against that. So yeah, definitely. So everyone's very excited about that. I think as well, they've made some new changes. AstraZeneca have been trying to get the efficacy of that particular vaccine up, and they've managed to get it up to 90%, which is comparable to the Pfizer vaccine. So that's also been really positive.
I see. David, one final question. How is the vaccine campaign coming along over in the UK? What has been the response from the public so far?
So it's mostly been pretty positive. So basically, the current campaign is to try within the next 2 weeks to get 2 million people in the UK to have the new vaccine. So that's pretty much everyone over 80 and all healthcare workers and care workers. And so far, things have been pretty positive. But I think the problem will be over the next few months as the vaccine starts to be rolled out more widely. There still is a substantial amount of anti-vaccine sentiment here in the UK. So that is going to be the main challenge. But 2 million people in the next 2 weeks, that's the big goal.
I see. All right, David, as always, thank you for making the time to join us live with the latest events from your end.
Thank you.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19 for this Monday. Now, while we wait for that to commence, I give you the figures again. We have 808 infections, including both domestic and international cases, raising our total for this Monday to 57,680 cases. We have lost 11 lives today, raising our death toll to 819. Those in quarantine stands at 17,593, while those fully recovered stands at over 39,000. Now, as we mentioned, the briefing has yet to start, so I have our consul with me again to tell us a bit about what is expected to be announced at the briefing today. Now, so you were saying earlier that at the briefing we will have a few bits of more information about the variant, the COVID-19 virus variant detected here in Korea.
Yes, that is highly likely. Jung Eun-kyung, the commissioner of the KDCA, will be at today's briefing. And as you just mentioned, she is probably going to have more information on the COVID-19 variant. Following the first confirmation of such here in Korea, as 3 people were found to have been infected by that new strain, which is highly contagious. It is said to be 40% to 70% more contagious than the original COVID-19 strain. And it looks like these patients, they had arrived on the 22nd of December here in the country. And if you remember, it was the 23rd when Korea started to ban flights from the UK or to the UK. That's the day when the Korean government made the announcement. So it's likely that these people had been infected before that in the UK. And actually one person out of these, I believe that patient was in his or her 80s, already died from this virus. So there is likely going to be more information on this variant in our briefing that's going to start soon.
Right, we have been told that the briefing is about to start. This briefing is for Monday on the latest COVID-19 situation here in the country. Right, also on the local front, U.S. Forces Korea is poised to start vaccinating its healthcare workers this week. The USFK secured its first shipment of Moderna's vaccines last week. The briefing is about to start. We'll come back to you afterwards.
Today we have Commissioner Jung Eun-kyung with the briefing.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of December 28th, we have 787 new local infections and 21 new imported cases. Currently, the total caseload now stands at 57,680. And yesterday, among those who were tested with suspicious symptoms stood at about 31,000, and 24,000 more cases have been conducted at the temporary screening centers, and we have confirmed 808 confirmed cases in total. And currently, we have a total of 17,593 people in quarantine, while 295 are in critical conditions. And we had 11 additional fatalities. I extend my deep condolences to the deceased and the members of the bereaved families. First, here are some updates on our domestic infections. As of yesterday, on a daily average, the domestic cases now stands at 984. And by region, we would like to go over some cluster infections. First of all, in Seoul's Songpa-gu district, in relation to disabled welfare facility, we have 50 cases confirmed to date. And in Seoul's Kurogu district, in relation to a nursing hospital and a nursing care center, we have 36 more cases being confirmed. In total, we have 170 cases being confirmed. And in relation to a hospital in Chungbuk, Gwaesan-gun, Eumseong-gun, and Jincheon-gun counties, we have 220 confirmed cases in total. And in Gyeonggi-do province, Pyeongtaek City, in relation to a place of worship, we also have additional cases confirmed there. And also in Wonju City, in relation to the religious facility, we have 15 cases being confirmed, and we are reporting these new cluster infections. And also in Chungnam Cheonan City, in relation to grocery restaurant, we have about 34 new cases, and the total now stands at 91. And they have been reported in Cheonan, Hongsan, and Asan areas. And also in Daegu, Gyeongbu, and Gumi, and in some of these these nearby areas, we also have increased a number of people who are infected through the religious facilities. And also in Gyeongnam, Sancheon-gun County, in relation to an acquaintance meeting, we have 20 cases to date. And next, let us now go over our quarantine analysis for the past week. On an average, on the domestic front, we have about 1,017 cases, which is about 64 more cases from the week before. And on a daily basis, we have over 1,000 cases. And as for these statistics, they include the statistics for December 16th. And also, for the imported cases, we also had a daily average about 30. And by areas, we would like to go over the statistics. And on the December 28th, we have had 984, and about 600 were in the metropolitan area. And also Gyeongbuk in about 63, and in Gyeongbuk, Muju, as well as aside from the Gangwon-do certain areas, we have been issuing the level 2 social distancing measures nationwide. And during the past week, in the metropolitan area, we have about 69.9% of the cases. And in the metropolitan area, we have the temporary screening clinics set up. And we have carried more than 500,000 cases so far and detected about 1,340 cases. And the positivity rate now stands at 0.27. And we have reported 143 deaths for the past week. And we have many people over the age of 70, and they account for about 85% of the total. And as for the sources of infection, most of them were from cluster infections from the nursing hospitals, and 76 of them, and 14 were contact with the previously confirmed cases, and 6 were through cluster infections, and also 129 or about 96% of them had underlying illnesses. And during the past week, we also looked at the sources of infection, and about 40.4% were related to the contact with the previous cases, and 18.5% were community transmissions, and also about 10.1% were related to nursing hospitals. And we have more than 2,000 or about 27% of the proportion under investigation. And we had 19 new cluster infections, and 6 of them, a majority of them were also related to nursing hospital or religious centers, and followed by nursing hospitals and family gatherings. And lately, in relation to these cluster meetings, also we were looking into the relationship with the confirmed cases, and we also identified that many of them were related to family cluster infections and at office buildings, as well as social gatherings. So we are seeing the need to abide by these quarantine measures, especially during these gatherings, as well as multi-use facilities. So we ask you to refrain from having family gatherings, and also ventilate your space on a regular basis. And if anyone has suspected symptoms within your household, please wear your face mask at all times. And also, if you are living with people who are over the age of 60, you should also restrict the visitors as well. And also at office spaces, you should also wear face masks at all times, and refrain from having physical meetings and gatherings. And also ventilation and disinfection is very important. And also cancel group meals. And if there are any those with suspected symptoms, they should get tested as soon as possible as well. And all religious gatherings need to be switched to non-face-to-face means. And also we have been reporting many cases of cluster infections stemming through gatherings, especially group meals. So we ask you to cancel these gatherings. And next, relation to the virus, vulnerable facilities, including nursing hospitals and mental hospitals and correctional facilities, we need to intensify our quarantine measures. And as for these nursing hospitals, we are carrying out the massive testings, and on a nationwide, we will be intensifying the regular testings, and we will be having these regular testings every 1 week for all of these facilities nationwide. And we have also seen many cluster infections, especially those with no symptoms or light symptoms, especially in the correctional facility and the military units. And we are also will be expanding the amount of swift antigen testings at these facilities. And as for the influenza outbreak here in South Korea, out of every 1,000, we have about 2.8 cases of influenza virus being detected, so it is below our annual average. And as for the samples collected through 5 clinics, we only had about 4 cases and 0.24%. And we would like to note that the influenza outbreak, the ratio of this outbreak is very low. And next, as for the virus genetic analysis of these virus samples collected here in South Korea, we have some announcements. And we have carried out the genetic sequence testings of the 1,600 people. And yesterday, we have conducted the sampling of people who have entered from Britain. And these results showed that we have confirmed the new variant virus from Britain. And as for these virus, we have analysis, we also have seen that most of these cases after May were a GH strain, which is different from those earlier SV or SR. And also, most of these cases until now, we have seen most of the cases here in domestically confirmed are GH strain. And as for the entrance from Britain, we had also carried out the genetic sequence testings, and we have confirmed the new variant of the virus among 3 people who entered into Korea on the 22nd of December. The UK government also confirmed that this virus is spreading at a very fast pace in the Britain. And also WHO also has confirmed and announced that these are also very transmittable. And as for these new variants stemming from Britain as well as other countries, we will be strengthening our quarantine measures. And as for the countries which have widespread of these new variant virus, we will also carry out the sequencing testings so that we will be confirming whether these people who are entering from these countries have such a virus. And these measures are aimed at stemming all of these new variant strains coming in from Britain and South Africa. And we are also intensifying our measures as well. And as Korea now has confirmed its first case of these new variant cases, we will be intensifying our quarantine measures. The current flight ban from Britain will also be extended for another 1 week. And we will also mull over the necessary measures going forward. And as for the people who are coming in from UK or South Africa, we will also have them to submit PCR negative documents, and these include Korean nationals as well. So it includes all of the foreign entrants as well. And as for new visa issuance, aside from diplomatic or other special needs, we will also be halting these visa issuance. And as for these people coming in from South Africa, these similar measures will be put in place. And also, in order to stop and halt the influx of these new variants, as these virus strain is also confirmed in other countries, other European countries as well. We will be carrying another round of PCR testings for people who are discharged discharged from their 14-day self-quarantine. And we also have confirmed on the 26th of December, we have been cooperating with the Infectious Disease Center in the U.S., and we will be carrying out our cooperation measures. We will be talking with Dr. Fauci, and we will be also working closely on any areas of research cooperation, and going forward, we will be also cooperating going forward. And this week is the last week of this year, and we understand that many people will be celebrating the New Year's holiday. However, we would like to underscore the following 3 quarantine guidelines that need to be remembered at all times by the public. First, please refrain from having social gatherings and stay home safely. And second, regardless of where you are, please wear your face mask at all times and indoors. And also, even when you are outdoors, if you cannot keep 2 meters of healthy distance, please wear your face mask. And also refrain from going to gatherings that make it difficult for you to wear your face mask. And third, if you have any symptoms like fever or respiratory symptoms, please visit the screening testing site to get tested as soon as possible. And next, we would like to go over some vaccine preparations as well as procurement here in South Korea. Up until now, the South Korean government, starting from April, we have exerted our full efforts, especially on a pan-government level, to secure vaccines for COVID-19. And in July, we also set up support committees to secure vaccines and also research and develop vaccines. And it consisted of ministries of Ministry of Welfare as well as Foreign Ministry and the Ministry of Food and Drug Safety. And we are also monitoring the safety of the clinical trials that are carried out. And also, in fact, in particular, as for the contracts with other countries in relation to the vaccines, our agency is in the lead, and we are also carrying out pre-advanced payment of these vaccines. And as we have mentioned earlier, we have secured about the vaccine doses for 46 million people, and currently we have about the vaccine doses for 36 million people. And as for another 10 million people of the vaccines for these 10 other million people, we are also under the discussions, and we will also devise our portfolio, and we are also carrying out these negotiations. And starting from next year, we will have these vaccines shipped to South Korea. And as for the vaccines, especially that have been secured, the 46 million, they stand about 86% of the Korean population, and we believe that they exceed the 100% of those who need to get vaccinated, and we believe that this is sufficient to say that we will develop our herd immunity. And the government will also exert our full efforts to secure more vaccines going forward in a stable manner. And we will also look at the timing and uncertainties of these supplies of the vaccines, and we will be speeding up our delivery of these vaccines. We are also speaking to the global pharmaceutical companies. And as for the vaccination program, here are some updates. And the government, starting from February and March, we will also provide the vaccinations to the public at this period of time. And also we will be providing our high priority group and devise this group before the end of the influenza vaccine program. And we believe that the optimal aim of the COVID-19 vaccine is to carry out our sustainable medical capacity and also decrease the amount of fatality rates and also curb the local transmissions. And we will have the high priority group, and among them, we will also make sure that the high-risk group, as well as people who are in the medical sector, including nurses and doctors, will get tested, and also people will get vaccinated if they are residents or workers of these nursing hospitals. And as for the efficacies and the transportation means, and also all these factors will be counted in, and we will also carry out and devise a detailed plan going forward with respective authorities and committees. And as for the vaccine types, we will consider their characteristics, and we have planned to carry out two types. And first, for the vaccines that need to be stored in freezing temperatures, we will have a separate center and designate these centers to give vaccinations. And as for these other types of vaccines, we will also have the health clinics, and we will designate a few health clinics around the country and carry out the vaccinations. And as for the transportation and storage, we believe that the COVID-19 vaccines are very sensitive to temperature, and cold chain storage is very important. So we are also conducting our detailed analysis and negotiation and with the other related government ministries, and we will also have detailed guidelines for these cold chain transportation as well. And as for Pfizer vaccine, in order to secure freezing temperature for these vaccines, we will purchase these freezing storage, and we are conducting our progress so far. And next, as for these center for a scheme to have an integrated vaccination program, we will also set up a system where we can enable a safe and convenient vaccination for the public. And this integration system is being set up right now. And through this system, we will also put in place the data for the vaccine supply, and also carry out reservations, and also registering of the people's side effects, any possible side effects, and also any other means that we need to also be highlighted. And also we will work together with the Ministry of Drug and Safety, and we will look at these adverse effects of the vaccines, and we will also have a government compensation scheme as well. And the pan-government efforts will be conducted and will be put forth going forward. And as for the details, we will be disclosing this to the public sometime in next month. And as for the vaccine procurement, we will provide you information on a regular basis in a very transparent manner. Thank you very much.
현장에서 한 16분의 기자님 질문 주셨고 사전 질의도 8가지.
The COVID-19 pandemic has brought sweeping changes to our daily lives and has put us on the fast track in our shift towards a contact-free society.
가장 많이 확산된 건 재택근무이죠. 특히나 이제 코로나 재확산이 이루어질 때마다 재택근무가 거의 당연시 됐다고 생각을 합니다.
Many observers believe that teleworking will become the norm, even after the pandemic is brought to an end. According to a recent survey in Korea, more than 2/3 of all respondents said they were expecting more businesses to adopt work-from-home policies in the coming years.
과거에는 이제 조직, 그렇기 때문에 이제 조직, 수직적 체계 이런 것들이 굉장히 중요했다면 지금은 어떻게 보면은 개인들 간의 협업, 그리고 이러한 개인들을 어떻게 이제 플랫폼으로 모이게 해서 활동을 강화할 것인가라는 그러한 개념들을 확대해 나가는 것이 굉장히 중요한 시점이라고 볼 수 있습니다.
The education sector was one of those hardest hit by the pandemic, with schools across the country being shut down for most of the year. With more children as well as adults now confined indoors as they ride out the pandemic, their attention has now turned to ways in which they can spend more quality time from the safety of their own homes.
홈 인테리어에 관련된 물품이나 서비스가 많이 판매됐고, 특히 의류 같은 경우에도 집안에서 입는 실내복들이 더 큰 인기를 끌었습니다. 그리고 심지어는 연말 파티, 송년회조차도 홈 파티 형태로 이제 이동을 하게 되면서 관련 상품과 서비스의 매출액이 급등하는 형태로 가고 있다고 보겠습니다.
A growing number of people are also accessing more online content, and even live concerts and performances are now being enjoyed virtually.
기존 문화예술은 굉장히 타격을 입었고 대신 온라인, 온택트를 통한 그런 콘텐츠 문화 소비는 나름의 어떤 새로운 기회와 계기를 마련해서 또 하나의 전기를 마련하고 있습니다.
The pandemic has also led to the explosive growth of contact-free services. According to data released by Statistics Korea on December 3rd, Koreans spent nearly $13 billion to shop online in the month of October, 20% higher compared to a year earlier. Customers are also seeking out healthier food options in hopes of better protecting themselves from COVID-19. And the use of face masks and hand sanitizers have resulted in 80% fewer influenza cases compared to last year. But perhaps nowhere else are the changes so visible and dramatic as they have been in the medical sector.
정부가 굉장히 많이 주도를 하는 그런 의료 체계 시스템들이 많이 나타나고 있는 것들이 이제 특징입니다. 특히 이제 백신이나 이러한 것들이 이제 정부 차원에서 지원이라든지 이런 것들도 민간 의료만큼 이제 공공 의료에 대한 이슈들도 굉장히 많이 높아지고 있는 것들이 하나의 그 변화된 현상 중에 하나일 거라고 생각이 되고요.
So what major trends are we likely to see emerge in the year ahead?
재택이 굉장히 많이 활성화가 될 거고 언택트 문화가 이제 계속 지속이 될 거라고 생각이 되고요. 집을 중심으로 해서 모든 생활들이 돌아가는 것들은 이제 지속적으로 계속될 것이라고 생각이 됩니다.
인간애라든지 어떤 사회적 관계, 어떤 따뜻함이나 이런 것을 더욱 그리워하게 됐고 2021년에는 아마 그런 방향성 속에서 사회문화 소비 현상 그리고 각종 정책들이 입안되거나 추진될 것으로 보입니다.
Taking cues from the hard lessons we've learned in this year of the pandemic, how must we prepare ourselves as we step closer to a contact-free society?
COVID-19 has blown in winds of change across societies worldwide. Face masks, social distancing, and assembly restrictions are the norm these days. And for more on the impact of these changes on the social and cultural fronts, I have Professor Choi Young-jun from Yonsei University. Welcome, Professor Choi.
Hello.
And I also have music critic Kim Young-dae. Good to see you again, Mr. Kim.
Nice to see you again.
Meanwhile, joining our talk virtually is Professor Richard Carpiano from the University of California, Riverside. Hello, Professor Carpiano again.
Hello, thank you for having me.
Right, Professor Choi, let's begin with a few words on the merits and drawbacks of a society based on non-face-to-face interactions.
Okay. People mostly talk about the negative side of COVID-19, but it certainly gives some benefit to our society, including the reduction of carbon emission and the environmental impact is certainly positive. And also, digitalization also gives some pre-benefit to us, so it's a good thing. But also, interesting thing about it gives more time to family member to get together, spending less time with the work colleague. So I think according to my survey, people have a better relationship with their family members. So this is a good thing. But obviously, we have many the dark and negative sides of the COVID-19. For example, many people losing job, particularly the contact businesses, including the hospitality, tourism, and also art and culture industries. And also, the many people also isolated. Generally, people's relationship with families get better, but we have a lot of single-person household, particularly elderly people. They're isolated, the loneliness, and the cutting social relationship is certainly a problem.
Right, the psychological toll has been tough. Meanwhile, Mr. Kim, what has been the impact of the pandemic on Korea's entertainment industry?
Well, it's a kind of bittersweet feeling, actually. Well, K-pop itself has succeeded in many ways in a lot of different aspects. For instance, BTS topped the Billboard chart not just once, for 3 times. And K-pop acts such as Blackpink continue their global presence in the mainstream market. But at the same time, the overall success is very limited to a certain type of performers, certain type of genre like K-pop, mainstream K-pop. So a lot of different acts, different artists, they've been really struggling the whole year. And so I think it's very successful in a watershed moment for K-pop and Hallyu in general. But it's definitely not a complete success. And if it's not COVID-19, actually this might have been the greatest year for K-culture. So definitely mixed feeling.
Right. Meanwhile, Professor Carpiano, the US stands as the worst hit country with regard to the total number of infections. How has COVID-19 affected the American society, Professor?
Well, there's just so many tragic ways that COVID's affected the United States. As a sociologist and public health scientist, and as a resident of Southern California, which is currently also very heavily affected right now, there's two biggest impacts that stand out for me right now. Are how a crisis like a pandemic really takes advantage of existing social inequalities in the United States. We've seen substantial disparities in risks of who acquires and who dies from COVID-19 based on belonging, for example, to an historically marginalized racial or ethnic group, such as African Americans, Latinos, Pacific Islanders, among others, as well as economically disadvantaged communities as well. And the second thing is really the attacks on the expertise and credibility of our scientific community. Really how we've seen a politicization of scientific evidence regarding masks, social distancing measures, potential therapies, and now even with vaccines, and really how important that is, or how critical rather that is, for undermining an effective public health response. It's really kind of shown us here how disinformation is really its own epidemic and in itself its own public health crisis that we need to be aware of both now as well as into the future.
Right. And staying with the dark elements, Professor Che, it appears that the pandemic has further promoted polarization, especially in the areas of economy and education. What are the potential problems of this phenomenon, and what would you suggest as possible solutions?
Well, if you remember the 2019, already inequality was the big social problem. But what about now? It gets certainly worse. People lost their jobs. And I don't think the companies will hire and recruit the new employees because the market is very uncertain at the moment. And also digitalization certainly gives the more room for employers to they lay off some of their workers. So I think the inequality and polarization would increase in COVID time. So I think the government should prepare the good job training, high quality job training policy package, as well as some good policy package for the young people to start their own business, because we need a very up-to-date good employers in the labor market. And also the learning inequality is a big problem because the students staying home, and some students are well taken care of by their parents and some of the others are not. So we need to also make a better education policy for these kids, as well as we need to give a better social safety net for the old families as well.
Professor Carpiano, an editor of a British weekly magazine, has claimed that this year of inept centralism amid the pandemic demonstrates the need for reform, the need for change. What are your thoughts on these words, keeping in mind America's COVID-19 response?
Well, the COVID pandemic has really highlighted how our form of government here, federalism, our governance structure, which is based on the coordination between federal and state governments, well, it works very well for lots of issues in terms of running the nation. It can present numerous challenges in mounting an effective response to a national type of crisis like a pandemic. We've seen this now with different states' local responses across all 50 states. As cases have risen and different states have needed to require different resources from the federal government, whether it be testing resources, ventilators, or even economic aid. And then what's further complicated this issue with this sort of federal-state coordination is really also how we've seen a real rise in the United States of polarizing partisan politics, which makes this type of federal and state coordination even more complicated, particularly during a crisis such as this. So we really do need to be keeping our eye out for and thinking about lessons that can be learned from this situation.
Right. Meanwhile, Mr. Kim, I understand Korea's music industry is leading the show with regard to virtual concerts and online interactions with fans across the globe. Please tell us more about this.
Well, actually, K-pop's been preparing, well, not this kind of moment, but for the future, using this, the technology, the augmented reality, virtual reality, even virtual performers as a next step for K-pop. So that's why we've been successful in this entertainment business under these circumstances. But I hope that the more support from the government and other institutions should be given to the smaller companies who don't have that kind of resources. So that's how we get through this situation and how we continue to claim our presence of Korean culture in the international venue.
Right, a good point right there.
Yeah.
Professor Che, what are the key COVID-19 related social issues that need to be tackled in the coming year?
Well, I think the economic insecurity is certainly a problem. Losing jobs and losing income, and that also certainly affect the children's educational performance. So I think the economic insecurity is a big problem, and that's why redistribution is also equally the important issue. Inequality means somebody does not affect, by the COVID-19, but surely some of they're suffering from the inequality and the COVID-19. So in this period, we need to think about how to redistribute our resources in our society and economy, and to help and also fill the gap about this economic insecurity.
Right. Professor Carpiano, speaking very briefly in a broader context, what are some of the social challenges faced by the globe post-pandemic, in your opinion?
Well, given time, I guess the one that I really want to emphasize is the importance of public health infrastructure. The pandemic's really highlighted how important it is to have a strong national public health system. And as we've seen here in the United States, really how that can we can see some tragic consequences of underinvestment at both the local and the national level. And so we often are so accustomed to going to private health care for tending to our concerns that we're often less aware of the role that public health plays for ensuring the health of the community, especially during outbreak response, as well as even vaccinations and a successful vaccination program.
Right, Professor Carpiano. I wish we had more time to delve deeper into those topics. Thank you very much for your time, Professor Carpiano. Professor Che, thank you for being with us today. And Mr. Kim, as always, thank you for your thoughts.
Thank you for having me.
Thank you.
Right. According to local authorities, 25% of domestic transmissions occurred within families. So do seek to abide by safety precautions at home as well. Thank you for watching. See you tomorrow.